Hi, Assalamualaikum. Here we are going to present our Bio 270 case study about super tall tend to die young, but not super small. Why? So before we start our presentation, let's get to know the group members.
Assalamualaikum, my name is AISHAH ADILAH binti ZAMSARI. My ID number is 2022820686 and we are from class AS1203B.
Hi, my name is AISHAH binti NAZRI. My student ID 2022699274.
Assalamualaikum warahmatullahi wabarakatuh. My name is SITI UMAIRAH binti Muhammad KADIR. My student ID is 2022896826.
NISRINA NABIHAH binti NORAFZANIZAM. My student ID is 2022879066.
Hi, my name is EFFAN binti RUSLI. My student ID 2022603764.
Okay, what is super tall? Super tall and also known as gigantism or giantism is a condition characterized by excessive growth and height, significantly above average. In humans, this condition is caused by overproduction of growth hormone in childhood. It is a rare disorder resulting from increased level of growth hormone before the function of the growth plate, which usually occurs at some point soon after puberty. Gigantism should not be confused with acromegaly. The adult form of the gigantism disorder has characterized by somatic enlargement, specifically in the extremity and face. Next, what is super small? Super small or dwarfism is a condition when an organism in human is exceptionally small and short stature as an adult. It is sometimes defined as an adult height of less than 147 centimeters, which is 4 feet 10 inches. The average adult height among people with dwarfism is 120 centimeters, which is 4 feet. The adult who has dwarfism disorder has characterized by stunt growth, poor sexual development, and either short limbs or short torso. This type characterized we call as disproportionate dwarfism.
Next is the symptoms of dwarfisms. The first one is they tend to have a disproportionately short arms and legs. Other than that, they also have a large head, a crowded teeth. A crowded teeth is because they have a small upper jaw. Other than that, they also have the symptoms of joints that seem overly flexible. Their joint is overly flexible or double jointed. This is because of the loose ligaments. They also have a flat midface and a prominent forehead. Next is the symptoms of giantism. Giantism, they tend to have a large head, then a jaw that seems to jut out. Other than that, they also tend to have unusual features of the face, such as a broad nose. Then, they also have a very large hands and feet with thick toes and hands.
Now, we are going to talk about the causes of super small, or we call it as dwarfism. What causes dwarfism? Researchers believe there are more than 300 conditions that cause dwarfism. Most causes are genetic. The most common causes include achondroplasia, growth hormone deficiency, hypothyroidism, and Turner syndrome. First, achondroplasia. This is a genetic condition that affects the growth of bones. It causes short arms and legs, a large head, and a normal-sized trunk. Second, growth hormone deficiency. This is a condition that occurs when the body does not produce enough growth hormone, which is essential for normal growth and development. It causes proportionate dwarfism as well as other problems such as pure muscle tone and delayed puberty. Hypothyroidism. This is a condition that occurs when the thyroid gland does not produce enough thyroid hormone, which regulates the metabolism and growth of the body. It causes proportionate dwarfism as well as other symptoms such as fatigue, weight gain, and cold intolerance. Lastly, Turner syndrome. This is a condition that affects only females. It occurs when one of the X chromosome is missing or partly missing. It causes short stature, delayed puberty, and infertility. Next, what is the causes of gigantism? Gigantism is a rare condition that causes abnormal growth in children due to excess growth hormone in their body. The most common cause of gigantism is a benign tumor on the pituitary gland, which is a small gland at the base of the brain that produces several hormones, including growth hormones. Other possible causes of gigantism are genetic disorders that affect the skin, heart, endocrine system, or nervous system, such as Carney complex, McCune-Albright syndrome, multiple endocrine neoplasia type 1, or neurofibromatosis. Gigantism can cause various symptoms, such as very large hands and feet, thick toes and fingers, a prominent jaw and forehead, coarse facial features, excessive sweating, headache, weakness, insomnia, delayed puberty, irregular menstrual periods, deafness, and vision problems. Gigantism is treatable, but early diagnosis is important to prevent excessive heat and other complications. Treatment options may include surgery, medication, or radiation therapy to remove or shrink the tumor and lower the growth hormone levels.
So there is some effect of why super tall differs than super small. According to the article that I found from Nicola Davis on 2018, he said that the tall people at greater risk of cancer because they have more cells in their body. We can see that taller people have a huge risk of cancer because they are bigger and taller compared to a normal people. More cells in body can trigger dangerous mutation to occur. Thus is increase the choice to get cancer. Second one is heart attack occur. According to the website heart.org, it states that our heart muscle need oxygen to survive. A heart attack occurs when the blood flow that brings oxygen to heart muscle is severely reduced or cut off completely. From the article of Jacqueline Howard, CCN, in year 2017, it states that there are a distance for blood to travel since tall people have longer leg vein cause the blood to travel up against gravity. This increases the risk of blood flow become temporarily stopping that can lead to death. Main are risk of blood clots in lung called pulmonary embolism that occur in thigh, lower leg and other locations. Otherwise, women only risk on blood clot in leg. Blood clots also added as biggest cause of stroke and heart attack.
Alright, now I will continue to explain about the statistic of syndrome gigantism or super tall cases. For your information, pituitary gigantism is extremely rare disorder because this case is rare in our country and another country as well. What means by gigantism disorder? Actually, it refers to growth hormone GH that occurs before fusion of epiphyseal growth plates. Most pediatric endocrinologists may see at more than 1 or 2 patients with this condition during their career. As example, we can refer that our large series of 2,367 children and adolescents with the pituitary adenomas. There are only 50 of them, or 0.6%, had the pituitary gigantism. Based on my research, I found that the latest cases reported is in 1st February of 2021. There are 100 cases has been reported having the gigantism in United States. The ratio of gigantism for gender reported that occur between the female to male is 1 to 2. The common age that excessive growth substance start to appear has been found to be around 13 years old. This is a growth curve of a boy that having gigantism syndrome. His born age is 14 years old. A lady of predicted adult height, which is 193.1 cm, which at 2.35 SDS. Around the serum GH concentration in morning is 15 ng per ml with a corresponding IGF-1 level of 720 ng per ml. It is normal range for age and pubertal status in a male, 123 until 701 ngl per ml. Upon review of his medical record, he has a growth velocity of 19 cm per year over the last calendar year. He is currently at the 99% for height at 179 cm, thus confirming the rapid gain in height. Next, I will explain about statistics of syndrome dwarfism or super small cases. Dwarfism syndrome is also a rare condition and disorder because it rare occur in our country and another country as well. On my research, I found that there is 200 distinct types of dwarfism. Bodies come in all shapes and sizes. Many conditions of dwarfism can have some medical complications, but most people have an average life expectancy. There are an estimated 65,000 people with dwarfism in the United States. In some cases, the child inherits the achondroplasia from a parent with the disorder, but in most cases, about 80% are caused by a new mutation in the family. This means the parents are of average height and do not have the abnormal gene. A genetic affects about 1 in 50,000 to 1 in 40,000 people. It makes your arms and legs short in comparison to your head and trunk. It's a growth curve for both gender, which is female and male, with drawn fins. For female, it shows the height for female with drawn fins or achondroplasia syndrome mean or standard deviation SD with compared to normal standard curve. The graph is based on information from 214 females. For male, it also shows the height for male with achondroplasia with mean or two standard deviation compared to normal standard curve. This graph is based on information from 189 males.
For the conclusion, Diagetism and dwarfism in human basically depend on the growth hormone, and there are the rare diseases happen in human. Diagetism or super tall happen when over-secretion of growth hormone stimulates the abnormal growth of the body, and the low secretion of the same results in stunt growth we call as dwarfism or super small. Diagetism or super tall has caused a lot of chronic disease than dwarfism. This serious condition has many drawbacks such as the enlargement of internal organs, blood clots occur, aggressive forms of cancer, heart disease and also heart attack. This is the reason why the super tall people tend to die young but not the super small people. Rate of death of gigantic person may increase if they don't get an early treatment. Several studies in the world over the years shown that the super small people tend to have a longer lifespan than the super tall people. So this is the citations and the reference that we use to finish our case study. We hope you guys enjoy with our video presentation. Assalamualaikum. Bye.